So it wasn't until the late 90s that American surgeons were freed up to be able to make the LASIK flap and then perform laser vision correction. So this is when I started my career as a laser vision correction specialist. I'd been doing thousands of cataract surgeries and other eye surgeries up to this point. And I bought an excimer laser, microkeratome, and I started doing laser procedures in 1998, 1999. Since then, I'm one of the highest volume surgeons in the Chicagoland area. I chose early on in my career not to go from city to perform these procedures because I felt a bond with my patients that if I was to leave them back behind in Minnesota when I lived in Chicago and not be there for them if they were to have some kind of problem in the week after the surgery, that I'd be very remiss in my responsibilities to these patients. Many of my colleagues that have performed 100,000 procedures or more have used this technique to achieve numbers that are of those kind of volumes. If one stays in one town, to have done around 50,000 procedures, somewhere in that range for me, in the past 15 years, is a pretty good number. How many procedures do you need to perform before you're qualified or is extensively, versed in the procedure probably matters less than how much passion you bring to every patient. It's not another, chink in the handle of your gun. It's a patient, and every patient that comes to me is a unique and example of how we can best perform these procedures safely and accurately. So though I've done thousands and thousands of procedures, every patient brings to me something that is of interest to me and that I can deliver some of my extensive experience to. And it is one of the most gratifying feelings to know that you can spot a pattern, spot some little detail about a patient that has been trained into your DNA by thousands of patients you treated before. It's that little instinctual feeling that you know something about this person that only doing lots and lots of procedures could have given you. But in the end, it's one patient, one surgeon. You're never any better than that last procedure you performed, and that's my passion, to give to you the very best I can give for every procedure. So if you have questions, give us a call. It's 630-724-1400, and you can also visit our website, glassesfree.com. And remember, there's no charge for your initial consultation.